We are going to start the second part of the integumentary system with decubitus ulcers. These are also known as bed sores or pressure ulcers. It's a localized area of dead skin. You can find it in the epidermis, dermis, or subcutaneous layers. They are caused by an impairment of the blood supply to the affected area as a result of persistent pressure against the skin surface. And we're going to talk about each one of these individually. Okay. So stage 1, the skin is not broken but is red or discolored. The redness or change in color does not fade within 30 minutes after the pressure is removed. And remember, the epidermis is the topmost layer of the skin. Stage 2, the epidermis is broken, creating a shallow open sore. Drainage may or may not be present. In stage 3, the break in the skin extends through the dermis right here, which is the second layer. So it extends through the dermis into the subcutaneous and fat tissue. Wound is deeper than in stage 2. Excuse me. In stage 4, the breakdown extends into the muscle and can extend as far down as the bone. Usually lots of dead tissue and drainage are present. Okay. And right now, this is on there. This ischial tuberosity is the sits bone. Scabies are another name for itch mites. It's caused by Sarcoptes scabii. It's contagious, and it has an intense pruritus associated with it. Commonly affects areas such as the groin, nipples, and skin between the fingers. Scabere means to scratch. Pediculosis, this is human lice. They are wingless parasites that feed on human blood. Both scabies and pediculosis are easily spread by close physical contact. So pediculosis corporis is the body louse. Pediculosis capitis is the scalp, and pediculosis pubis affects the pubic area. Seborrheic keratosis, and keratosis has to do with the thickened area of the epidermis. This is benign. It originates in the dermis. You have tan, brown, greasy papules or plaques. It may be slightly elevated with a wart-like texture. This is a dermatofibroma. This is benign, scaly hard growth, slightly raised, and it's pinkish brown. Keratoacanthoma. This is also benign, smooth red dome-shaped papule with a central crust. Keloids and hypertrophic scars. So these are keloids over here. They extend beyond the wound site and do not regress spontaneously. They occur because of excess collagen formation in the skin during connective tissue repair. And these usually occur secondary to trauma or surgery. Now, the hypertrophic scars, on the other hand, are confined to the site and generally regress over time. Epidermal cysts, they're also known as sebaceous cysts. They're benign. The sebaceous gland slowly fills with a thick fluid. Acrocordon, this is also known as a skin tag. Benign, painless, usually caused by friction. And I have these on my neck. They're not quite that big, but I'm sure they'll be getting there. Actinic keratosis, now this is premalignant, seen on sun-exposed areas of the body. Basal cell carcinoma usually does not metastasize, caused by pre-adulthood sun exposure. It's the most common and least dangerous of the skin cancers. It grows slowly, usually on the head, neck, and upper torso. It appears red, pale, or pearly in color. Appears as a lump or dry scaly area. May ulcerate or fail to completely heal. Now, the squamous cell carcinoma usually does not metastasize, and it's caused by recent sun exposure. It appears as a thickened, red, scaly spot that may bleed easily, crust, or ulcerate, and it grows over some months. Now, the bad boy is the malignant melanoma, and a melanoma is cancer of the skin's melanocytes. It's the most serious of the skin cancers, arises in the epidermal melanocytes, thought to be caused by a severe sunburn in childhood. Okay, now let's talk about the ABCDEs of melanoma. A is asymmetrical, one half unlike the other half. A border, irregular or poorly circumscribed. And circumscribed means it's bounded by a line. So there are clear edges when you have a circumscribed border. C is for color, varied from one area to another. You have shades of tan and brown, black, sometimes white, red, or blue. D is for diameter, usually larger than 6 millimeters. 6 millimeters is the diameter of a pencil eraser. And it's evolving. Any change in size, shape, color, elevation, also if new symptoms appear, such as itching, bleeding, or crusting. Albinism, it's inherited. The melanocytes are unable to produce melanin. Vitiligo, it's also called leukoderma, produces pale, irregular patches of skin, often evenly located on one side of the body. It's a progressive disease in which the melanocytes are gradually destroyed, causing unpigmented areas on the skin. It's caused by the inability of the melanocytes to produce melanin, or the melanocytes are absent or destroyed. Melasma, brown patches that appear on the upper lip, forehead, and cheekbones. Trigger, hormonal imbalance could be caused by pregnancy or oral contraceptive use. One or more layers of the skin may be affected. Hemangioma, this is benign, proliferating blood vessels in the dermis and can produce a red, blue, or purple color. Nevus is also known as a mole. It can become malignant. You have small, dark areas of the skin and composed of dense collection of melanocytes. Pityriasis, this is a fungal infection. You have patches of flaky, light, or dark skin that develop on the trunk. Okay? This is caused by the fungus. And the fungus that causes this is Malassezia furfur. Alopecia, this is baldness. It's the loss or absence of hair, especially on the scalp where it normally grows. May be hereditary or can be caused by disease, injury, or treatment such as chemotherapy, or may occur in old age. Folliculitis, this is an inflammatory reaction of the hair follicles. You have erythemic pustular lesions. Okay, and the next one is verrucae. These are also known as warts. They're elevated growths of the epidermis, and it results from hyperplasia. It's caused by the papaviruses. So you have verruca vulgaris, that's the common wart, caused by HPV2 and HPV4. Now guys, you will not be tested on this part, it's just FYI. Plantar warts, which are caused by HPV1, these occur on the soles of the feet. You have venereal warts, which is HPV6 and HPV11, and these occur on the genitals and around the anus. And the last term is peruncia. This is an infection of the skin around a nail. And that's it. Thank you.